will lead us in the pledge. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Very good. Roll call. Ms. Teresa.
Commissioner Matthew,
I am here.
Commissioner Huffmeister,
Present.
Commissioner House,
I am here also.
Commissioner Leininger, Commissioner Baker,
Yep.
Commissioner Lanius.
We have a quorum. Thank you, gentlemen, for joining us this morning.
I wouldn't think anywhere else.
It was touch and go there for a while. C, approval of agenda.
Move the agenda.
Support now. All right. We have a motion and support. All in favor with an aye. Opposed the same. Motion carries. Approval of the minutes.
Approve the minutes, place on file.
Very good. Do we have a support?
I support.
Yeah. Okay, good. We have motion and support for approval of the minutes. All in favor with an aye.
Aye.
Opposed the same.
Support alerts.
Carries. Yes. Very good supportive people here. All right. Public comment. We have item number 2, public comment. Anybody in the audience like to?
I'll stand today.
All set. Okay. All right. Very good. We'll move on. Health officer's report.
Good
Mr.
morning.
Rebecca, good morning.
So I also added a supplemental to your spot, and why don't we just go ahead and start there? The administrator for Branch County notified me that he does have an estimate now for the repairs to the restrooms, as well as the replacement of a countertop in our clinic area. And that estimate is $62,700. That goes to the Branch County Commission today, and they will review and make a decision, according to the administrator, on forwarding this and other projects. And should that go, then the estimate, the group that did the estimate will reach out for bids. So we're still a ways off, I think, from getting this accomplished, but we are seeing some progress, which is good. So that is that. I wanted to share Senate Bill 875 as something that you might want to watch. This particular Senate bill would add 12th graders to the requirement for 7th graders that's currently in place to show vaccination status at the beginning of the school year. So the legislation also ties the immunization schedule to what's recommended by the CDC's Advisory Committee on Immunization Practices. So right now, 7th graders have to show that information. The schools work with their families, and then we help get people caught up. Adding 12th graders would be a big lift, right? And also tying this to the CDC's Advisory Committee on Immunization Practices could increase waiver rates significantly. If we look at the ACIP, it requires or recommends COVID and influenza vaccines like that. So there's concern that this legislation could really increase waiver rates amongst our younger population, which would be a strain on the local health department because that has to be done through our agency. And also at a time when our vaccination rate is already low, we would like to see a decrease in waivers. So making a requirement that another group of individuals are required to either receive a vaccine or get a waiver probably isn't the best idea right now. So just wanted to bring that to your attention. And then the last new thing that happened this week was a positive Eastern equine encephalitis horse case. So some of you may remember a few years ago, and actually prior to the pandemic in 2019, we had some human cases of Cripple E. And no one wants to get triple E. Treatment for that is supportive therapy, and most people have, if they make it, have lifelong handicaps as a result of having that disease. So it's a mosquito borne. One of the reasons that we do the mosquito program that we do here is to keep an eye on the vectors. We have been doing some mosquito surveillance for triple E here because we have some of the habitat that's ideal for the mosquito that transmits triple E. It's not surprising to have an animal get triple E and die during the year. It tends to always happen more in the fall. That's when the viral load is higher. Horses can be vaccinated, people cannot. So our advice to everyone is to prevent the bite. Wear long sleeves if you're going to be out, wear insecticides, and just take precautions to prevent getting bit and avoid mosquito-borne diseases, of which only one is triple E. There are others to be concerned about, like West Nile virus, for example. And we've had human cases of that this year, so in Michigan. Okay, so any questions on those three things? I did also provide a copy of the weekly arbovirus summary for your review. So I do want to announce Joe Frazier has been selected as our new environmental health director. You guys have met him before. He's been here when Paul has not been able to attend a meeting. So welcome, Joe. He is getting right to work. This is your first week, right? Was it last week? It's the second week, man. Time flies. So drinking by a fire hose pretty much, and
100%.
embracing every bit of it. So
Welcome, Joe.
Thank you.
it is respiratory virus season. We are entering that season now. We want to encourage everyone to receive their flu and COVID vaccines. We are able to vaccinate here, and if anyone's interested, we would be pleased to take care of that. So let us know. I wanted to give you an update on the National Labor Relations Board. I had mentioned this previously. Our attorney filed a position statement on lack of jurisdiction requesting dismissal. But we have recently heard from the NLRB that they would like to collect some additional information or statements, and our attorney continues to work with the National Labor Relations Board on that item. Quality improvement, we pulled together our quality improvement team, which includes not only our supervisors and directors, but also staff representing each division at the health agency. And we did a day of training and familiarity with quality improvement. So this is an important project. We believe in the power of quality improvement and how that can help move us forward. And I'm excited about all the folks we were able to bring together for that training. We are getting closer to the portal for our Hedgerow software. That's our software. We had a meeting yesterday with the developer, and there's a few more minor tweaks that need to happen, but very, very soon we're going to be able to share with residents of the 3 counties that they can make an electronic application, pay electronically, do everything that they need that way. So kind of bringing us into the current century, so to speak. We do have an employee assistance program that we were able to buy into a 1-year contract with. This is a product that helps to supplement our current insurance offerings, and we used our wellness grant funds to pay for that. There is a flyer or brochure in your packet on the EAP that's right after my report that would give you more information about that. We are having an onboarding meeting, so to speak, with our staff about this product today. It actually went live on 10/1, and we'll give it a try and see how our staff uses it and make decisions about whether or not to continue after our first year. So with regards to staffing, we're getting closer to filling our mobile clerk position, I believe. Heidi's not able to be with us today, but we are getting closer to that. Our area agency on aging is still seeking our outreach specialist and has just accepted the resignation for the nurse care consultant. So Laura will be working on filling those still. And with our new EH director in place, that opened up one of our supervisor positions in environmental health. So we currently have one supervisor position open and one supervisor position filled. And I'll let you talk more about that when it's your turn, okay?
Will do.
Okay. Kindergarten oral health assessments, those interviews were completed, and we have a dental hygienist that we're just working out the final details to bring on for the kindergarten oral health assessment. So that's exciting news. You do have in the agenda today the medical director contract for one more look. After the board meeting, Dr. Luparello expressed a desire to do a 1-year contract instead of a 3. And we did go ahead and do that because we needed a medical director as of 10/1. But your vote was for a 3-year contract. So I'm asking that you revisit that topic today and that we just formally accept the 1-year contract. Public Health Conference is coming up mid-October. I will be attending along with Teresa and Heidi. If any of you are interested in attending the Public Health Conference, you are, also, of course, welcome to do that. It is in Muskegon this year. Gleason Road in St. Joe County. We have talked about this off and on, and they have a permit to work on replacing a section of that line that continues to break and have sewage on the ground surface. So we are very pleased to see that. Our PFAS sites are going to be overseen by our type 2 water EH staff. Joe and I have met with those staff members, and they're already getting to work on understanding our PFAS sites and the families that still need to be taken care of there. The Quincy Schools Health Concern in Teens, the final letter and FAQ document have been released. They are posted on the Quincy Schools website. That is really, at this point, it's been put to bed. Highly pathogenic avian influenza, still seeing detections in the state of Michigan. There was another county with a dairy farm found recently. Activity is slower, however, slower than it was before. Rabies, this is also kind of like with mosquitoes, the time of year when we see more activity here. And I provided the most recent information on rabies positive animals. Head lice is another thing we've had some contact with the schools on. There's been every year families come back and we have cases of head lice, and this is really a nuisance item, causes much concern, very difficult to get rid of, and so we've had some nursing staff working with the schools on that. I already talked about our cold water office projects. In Hillsdale, we need to replace our water softener, and the county is assisting us in collecting bids. We'll be bringing that to finance because replacing that water softener is going to be above that $5,000 limit. So that's coming soon, and the dumpster trail has been replaced over there. We do have a piece of flooring in our new suite in Sturgis that is not living up to its warranty. So we have notified the landlord, and they are having the flooring contractor come out. And we do have board education today that will be provided by Terry Penny on Children's Special Health Care Services. Terry's in the audience, so she will be ready to provide that at the end after everything's done today.
Very good. Thank you for that report. Any questions for our?
How long is the contract up?
This is the last year.
No. How long is the contract? 3, 4, or 5 pages?
Oh, my contract for medical.
No, medical.
Medical director. maybe?
Three
We
or
have a
four?
copy of that somewhere. I just want to see what the change may be between the 1 year and 3 year.
It was in
Literally.
Glenn's,
But I know what, as far as,
Wasn't much.
Teresa will grab it. Really, the salary stayed the same. There was a tie to salary to increases that the health agency gets, which
won't matter if you're front.
there's no guarantee of any increase that way, okay? And then the term, I don't think anything else has changed.
I think that was.
All right.
That was our thing when we approved the 3-year, the tie to the employees increase. So we already approved that.
Yes.
Literally, the only thing that we would be changing today is going from 3 years to a 1-year
Right.
contract.
Right.
Mr. Chair,
Yep,
are we going to discuss that now or later?
we can discuss it.
Right now,
It's up to you.
is it, Dr. Loprillo, is it,
Well, it is on the agenda, under item 8B.
Stay with you.
That will
that's,
give me time to get a copy of it.
That sounds good.
that's Dr. Loprillo's request?
Yeah. Yep. Yep.
Just want to make sure.
Mhm.
Thank you.
Any other questions for our health officer? Very good. Thank you so much for that. Moving on to our medical director, Dr.
Good
Luke.
morning.
Good morning.
My report for the month is in your packet. I'm also taking some emergency preparedness classes that we all take, but kind of draining, aren't they? To be very honest, but so working on those as well. I'm part of a TB subcommittee, which has been kind of interesting. It's looking at TB across the state of Michigan, and all of the medical directors are kind of chiming in on what they're seeing and how they're treating things. So that's been quite informative and kind of good to see how other people are handling things. And again, the nursing supervisors and I have been chatting. If we start seeing greater groups, we might do some group classes and some group things to kind of take care of those patients instead of seeing one at a time. But right now it's been fine just seeing 1 or 2 at a time. My educational piece is on Candida auris, another great reason to wash your hands. So I kind of clump those things together, right? Like there are so many good reasons, especially in the fall right now, to hand wash and use hand sanitizer. It is pretty amazing. So, and the amount of people that you don't see wash their hands surprises me greatly. And so I kind of encourage people when they go into offices to just ask people to wash their hands if they haven't. I mean, the first time you do it, you feel like you embarrass the person, but after that, you feel like you're advocating for the people that you're with and for yourself and to not spread it around. And it kind of goes a long way, I think. So Candida auris has gotten lots of press lately. And I'm a little surprised it didn't come to a head during the COVID stuff as well, with the transfer of patients from long-term facilities to the hospital and that, because this is usually a fungal infection of, I don't want to say elderly people, but perhaps people that are in mental or in health facilities long-term. So chronic diseases, their skin can get Candida auris, and it is a very resistant fungus. We don't have great treatment for it. And if you have to be treated for it, antifungals are quite toxic to your system. So the way to deal with this is to kind of stop the spread and to identify it early. And it has the same symptoms as any bacteria or virus. You can get a fever, you can get a rash, you can become really sick. It can affect your blood, it can affect your brain. So it's kind of gotten a lot of press lately because of patients transferring back and forth from the hospital to extended care facilities. And so the issue with it is this fungus can live on surfaces for weeks. So you think about when you go get your blood pressure checked, right? All of those things they're using, all of those things we're touching can be infected with this fungus. So healthy people, not a problem, right? In fact, healthcare workers in the facilities might culture a little on their skin, but they don't get sick. They don't have a problem. But if you're there visiting a patient in a long-term care facility, it's really important to wash our hands. And the labs that you'll see some wording on here, very similar to identifying COVID, the PCR test, the polymerase chain reaction that we used, and some other laser-assisted ways to check it. The other issue with Candida auris, is very hard to get rid of. So normal hospital disinfectants we're finding are not really taking care of it on the surfaces. So they're coming up with some new things, some hydrogen peroxide things, some UV radiation things. Bleach is usually pretty good at getting rid of it. And the mortality rate in a compromised patient in a medical assisted home can be anywhere from 30 to 60%. So people are dying of this, and we don't have a great way to take care of it and to watch the spread. So biggest thing, again, hand washing, identifying those patients so that they're not going back and forth, from extended care to the hospital, to your office, to, visit their relatives back into their nursing home. So again, if you visit, make sure that you and all of your family members are washing. And then they're trying to place patients with Candida auris in the same center of the facility so that we can kind of contain it, which is good. So see, I think that was about it on Candida. So again, with the flu, it's just another good reason to wash your hands. It's not spread in the air, right? So it's not respiratorily spread like the flu. So if you're near someone and they're coughing, you really don't have to worry as much, but they have cultured it on surfaces weeks after. So you want to make sure that you hand wash and take good care of that and hand sanitizer. So any questions? Candida auris, it's just another thing that we need to be aware of and wash our hands.
I'm just wondering what's in the hand wash that kills. Maybe we should start using that at the hospital, rather than having to look at the hydrogen peroxide.
I know.
Any questions for our medical director? All right, thank you for that report.
Thank you.
We appreciate that. Moving on to department reports. Area Agency on Aging, Ms. Laura.
Good morning.
Good morning.
So it was kind of a lengthy report this time. We did have a couple of closures of note. Our providers did a great job this year with their assessments. We did have one pretty substantial recommendation for the St. Joseph County Transportation Authority. Their background checks now for the second year in a row have been just shy of perfectly compliant. And when you do quality assurance checks like this, you'd like them to be a little bit more policy and process driven, and it hasn't been. So we tried to outline that in our recommendation, and then as well as we had a great technical assistance meeting with the executive director and his operations manager. So we think that they'll be in better shape as we go into this new contract year, and when we see them next spring for our provider assessments. They are compliant. They did get all their background checks according to policy, but it was not done in time for our assessments. So there's a glitch in terms. We think we've identified that, and I know Alan and his team are working on that, but the board needs to be aware of that. Everybody else, including both nutrition providers, are doing a great job. When you go on these home delivered meal routes, if you've never been on one, we would welcome you to go on a route anytime. You see things that you're not normally seeing every day, and just how isolated people can be in the conditions of their home and their yard, and who might be hanging out in the backyard doing whatever they're doing, potentially living in sheds and all these things. So it's always an eye-opening experience. For 20 plus years now, I've been going on these routes, and certainly we welcome any Board of Health member to go on a home delivered meals route if you ever are interested in doing that, to see just how important these home delivered meals are, to touch base with people every day or nearly every day to assure their safety. We also received an email, unfortunately, from our adult day program in Sturgis, who also serves the western side of Branch County, that they are intending to close the adult day program as of the end of the year. So with that contract termination, it came just in time. So we were able to just issue a 3-month contract. And so now we have some dollars that we can look at for development of a new adult day program, which would incorporate potentially a broader sort of scope. I've already had a meeting with our friends at Maple Lawn Medical Care Facility that is a potential site, as well as a couple of others that I have in mind to potentially work with on seeing, engaging their interest in an adult day program. So we're in the process of, there's equipment, supplies, more supplies than equipment, and items that have to be developed into a disposition plan, what they call a disposition plan. So we're working with their director on that, and I'm sure it will go fine. It's just sad to see such a great provider make different choices, which every organization has a way to do. It's just a loss for our agency and for our community. So we'll be sad to see them move on to other ventures. Are there any questions with regards to either of those enclosures? Because they're kind of big. Updates. We did have some great feedback and have already received multiple referrals from our local police departments here in Branch County as a result of some community partner trainings that we've done. And I shared the new brochure with the board that's gone over very well. We're also working to get into Pines, the Branch Area Transit Authority, and then have done a few events already at the Commission on Aging here in Branch County, and then we're headed back over to St. Joe, and things are underway with our central dispatch office over there. So things are good there, and our meetings are going well each month with both counties' interdisciplinary teams. I do note, and it's sad to have to report it, but homelessness is just still such a serious, ongoing issue. We have very full shelters in both counties, and it just constantly is a challenge that we're facing in the work that we do. So I wanted the board to just be aware of that. We're all set for the VOCA grant for fiscal 2025, and looking to expand and continue our work with Region 2 Wellwise over in Hillsdale County, because they have a neat housing component, and I keep sort of churning my creative wheels about how we might be able to replicate that over here in some way, shape, or form. So just so you know, that's kind of churning in the back of my mind. I offered an update on the fiscal 25 budget. We did get a statement of grant award on September 30th to start kick off our new fiscal year just this week. We got 2 months of funding. So that's the update there. Year-end prep is ongoing, working with Teresa's team and Teresa and our team to make sure that we spend just as much as we can according to all the rules and all the guidelines that are established by the Bureau. And, we need to maximize, and we've been in a lot of communication with, especially our Commission on Aging offices, because they have such a large portion of all those grant dollars. So it's going well. We've had some great outreach events already. Kalamazoo County Expo Center. We already had that day. They reported that they got a referral that day. So a lot of our folks go up to Kalamazoo to the larger health systems for care. And so we need to network with those folks to make sure that they know that we're the area agency that serves St. Joe County. And it ended up paying off and saw some people that we really needed to connect with. So that's good. We haven't done that event. I don't think I'd gone, it's probably been close to 20 years that I've been up there. Just because it's, it's a distance, and you don't always, want to prioritize an entire day to go to somebody outside of the county, but it paid off. So we may consider doing that again ongoing. There's a new event that a local faith-based organization here in Branch County is starting. It's called the Older Americans Health Fair, kind of sunsetted a few years ago before COVID. This entity, this Hope Church here in Coldwater, is going to put on an event Saturday, October 19th. So we're going to give that a shot. And we'll be back over in St. Joe County for the Veterans Stand Down and Project Connect, which is always a really good event on Friday, October 11th. I wanted to introduce Shelly Bixler Martin, our new social work care consultant. She's been with us a couple months now, and we're very pleased to have her because she has a great sort of calm, person-centered approach with our participants, and has a great background in home care, hospice, and mental health, which is always very helpful. So, Shelley, did you have anything you'd like to ask the board, or board members? Would you like to ask Shelley any questions?
I don't.
Welcome, Sally. Welcome, welcome.
And then I did make a few other items a note that the department is underway with a couple major initiatives and potential shifts in how programs and projects are administered at the state level. There is a bid out right now for individuals enrolled in Medicare and Medicaid, and health plans are in the process of putting together bids to serve those folks at home. So we're working with our association in trying to make sure that they understand how comprehensive the aging network is and how we could work to help support those individuals. It would be a different sort of funding source or line of business, if you will. So we're trying to remain engaged in those conversations and working with our colleagues at the agency to be a go-to for those health plans to do that work with people that are dual eligible in our training and service area. And then the other sort of major development was that the Bureau recently told us that they were going to be issuing a request for proposal for options counseling and the state health insurance program, which is a statewide initiative. And so we'll remain closely engaged in those discussions as well, and should that come out. We want to be a part of those programs moving forward, so we would likely put together a response to that RFP. So kind of came out of nowhere though, kind of reeling. We were up at the commission meeting. It had just sort of been announced that week, and so my colleagues, 8 of us, were before the Commission on Services to the Aging, and all made very unique and distinct comments related to the decision, because it was delivered differently than a lot of these types of decisions and initiatives typically evolve. So it put us all back on our heels. So, but we understand change is inevitable, and we're going to stay positive and keep our heads above the line as we move forward with those 2 projects. I did also place the response letter from the Bureau at your places because it came out, of course, after the board packets, but our plan for the current fiscal year, now fiscal 25, was approved. There are no special conditions. Happy to answer any questions you might have.
Any questions for Director Laura? Good. Very good. Okay, well, we appreciate the report.
Thanks.
Yeah.
This year from the Bureau, I don't know if you have any questions for Ashley, or Ashley, if you have any updates that might be of interest to the board.
Yeah, I think folks.
Yeah. Welcome, Ashley.
Laura probably sent us budget updates before Cindy's most recent
Yeah.
email. So the continuing resolution was passed through December 20th. And so the ACLS Bureau, can you hear me okay? The ACLS Bureau did issue 2 months of funding, but we have not received our state from ACL. And Cindy Masterson did say that usually continuing resolutions are based on the previous year award, but ACL does have access potentially to the updated population numbers, which, as we know, Michigan's older adult population is increasing, but the overall population is decreasing, and those are factors that do kind of go into what ACL sends out to the states. We have our interstate funding formula. They also have a funding formula that they use. Those are 2 factors. So I say all that to say that we don't know if we'll see increases or decreases when we actually get our award to be sent out. So I know Laura mentioned that at the previous meeting or meeting before. So we're still kind of guessing essentially. So we did the 2 months just so we could wait and see what it's going to look like. There may be more funding that can come out if there's an increase. If there's less, then we'll have to adjust for that as well. So I'll keep Laura updated on that. City Masterson is really good about staying on top of it and keeping us updated, but there could be an increase or a decrease.
If our senior population is becoming a higher percentage, wouldn't that bode for an increase in
I'm sorry, can you
funding? Yeah, so if our senior population is increasing as a percentage, that would hopefully mean that we get more funding, right?
It's, if that were the only population that it looked at, then yes, but because it also factors in overall population and that is decreasing, that, yeah, they're kind of working against one another. Yeah, unfortunately. And from ACL, it's not just Michigan, they're funding for everyone, so it just kind of depends on the fluctuation. Yeah, so a lot of moving. As Laura mentioned, she presented the plan September 20th meeting to the Commission on Services Aging. As always, did a great job, and they had a few questions, but their questions they literally asked to everyone. It seems every year the Commission kind of has things that they're focused on. This year it was, they asked everyone about board makeup, advisory council makeup. Does the advisory council match the population that you serve? Are all voices, all different groups being represented at that table? So that was something at the August meeting and the September meeting. They were very interested and had some questions about. And as Laura mentioned, every AAA that got up there and presented had some feedback for the commission and Scott. Some of the big decisions that have been coming out of those bureaus lately. So they all did a great job advocating. And the Older Americans Act final, I did want to just hit on that because there's still a lot of moving pieces there. As I think I mentioned several months ago, the Older Americans Act has not been reworked since the 80s or something. So there are a lot of changes that had been made. So we're working closely with Advancing States because some of the changes are minor and can just be tweaked within, our operating standards policies, but some are much broader and are going to take more time. The date to come into compliance with the new regulation is October 1st of 2025. That's not going to happen for everything all the big changes that are going to be made. So they're allowing,
Plan of correction.
corrective action. And pretty much every state is they have to submit a corrective action for some portions of those changes because they're too major. There's sufficient pieces. They're too big to bring into compliance by October 1st. ACL and Advancing States have said that's not like a slap on the wrist. They know that those are coming and it's completely to have those, and they want it done right, so they don't want everyone just kind of slapping something together. That's all I have. Taking questions. So.
Any questions for Ashley? Thank you very much for coming and for the report. We appreciate it. Anything else for Director Laura? Okay, awesome. Thank you so much. Moving on to personal health and disease prevention.
Right. So Heidi is attending a training today or webinar on finalizing our maternal infant health grant. So this is always a challenging grant with a lot of intricacies, and I excused her today so that she could attend it and feel more comfortable about that job duty. So her report is in your packet. Some of it I actually touched on as well. She does mention that we've had a handful of positive influenza cases recently. So again, another important reason to get your annual flu vaccine. She updates us on measles there. Talks a little bit about COVID-19, which activity is rising in Michigan. So the updated vaccine is available for that. And especially if you have health conditions, that's a vaccine you might want to consider. Her test.
Is that combined with the flu now, or is it two separate vaccines?
Two separate. Yep. 2 shots. Yep. Pertussis cases are also increasing. This is, of course, concerning for our youngest population, and there is a vaccine for this. So if we can get people vaccinated to prevent spread of that disease to our infants. That is the best way to take care of that. And she mentions rabies as well. One positive bat from Hillsdale County recently. So we're on the map now, and that arbovirus map is in that additional supplement that I gave you, although it's not in color, so it is a little hard to decipher. I can send you out the link if you'd like to look at it in more detail.
See where our organizer at.
Mhm.
We got rabies.
Yeah. Well, let's hope not, but. And she provides some updates on Wicked Air, Children's Special Healthcare, Hearing and Vision, COA, and things are moving right along for Heidi. So is there anything that I can bring back to her that you'd like more clarity on?
Any questions? Yes. Thank you for that report. We appreciate you filling in there. Health education, Chris.
Good morning.
Good morning.
So you have my report in your packet, just a couple of highlights. We have finished this 2024 lockup campaign. Proud to report that we distributed 1,100 safe storage devices. We reached over 12,000 individuals and 27,000 social media impressions, 1,300 post engagements through our social media campaign this year. And we also had approximately 1,000 views of our video series on YouTube, and those videos will remain up and available for the population to review at their leisure. We are currently working on the Public Health Workforce Interest and Needs Survey that launched on September 13th, and as of yesterday, 42 of our 76 surveys have been completed. So we're at 55% participation, and we have several weeks to go. So we are very hopeful that we will reach the benchmark. We need to receive another 22 surveys in order for the agency to receive detailed information that will be aggregate for the entire agency. And that will help us as we look at employee satisfaction and work and quality improvement for the agency related to the work environment. We participated in the Branch County Community Baby Shower that was held on September 28th last weekend, and there were approximately 70 family members in attendance at that baby shower. I believe this is the second or third year for that baby shower. It's one of the newer ones in the jurisdiction. And our breastfeeding peer provided a educational session on breastfeeding, which was well attended and appreciated by participants who took part in it. Our office issued 3 press releases since we last met, and we had 14 media outlets pick those up on 14 stories. So we were very happy about that as well. Our community health worker program, Lisa and Ali have been very busy. They finalized all of their certifications and everything they needed in August, and they were still able to serve 20 clients. And so we're very pleased with that. Our greatest needs are assistance with Medicaid applications and redeterminations, individuals trying to find financial resources. They have low income or no income. Individuals looking for housing, as Laura mentioned, homelessness. We are getting a lot of homeless individuals referred to us for service. Food security is also an issue, and transportation. On a positive note, we received our first financial reimbursement payments towards our CHW program, which is part of our strategy to be able to maintain the program beyond our grant funding, which will end September of 2025. So we're working hard to find a sustainability plan and the ability to receive reimbursement from insurance as part of that plan. The other part of our sustainability plan, which I'm excited started yesterday, we have entered into a relationship with Covered Bridge Healthcare in St. Joseph County, and our community health worker will be working with them 2 days a week, and he will be providing community health worker services to their clientele in those 2 days. So it's another piece of our sustainability project. So Ali will work with us on Mondays, Tuesdays, and Thursdays, and he will be at Covered Bridge on Wednesdays and Fridays supporting their work.
Is that private health insurance reimbursement or is that through
Medicaid.
Medicaid? Yeah.
Medicaid reimbursement. So, it's taken us some time. We've been trying to successfully bill since about May. And we finally received our first payments, so.
It's a huge win.
It's a huge win. We still have a lot of work to do, to get all of our items paid, but at least we have seen 3 payments, so.
But this doesn't start like a monthly trend then. Like you continue how to have this lead time between when the services are administered to when we actually get paid.
Well, actually, the payments we received were for payments that we actually offered in August. So it just takes us time to develop the system and the process and to ensure that we are submitting our claims, what they call clean claims, so that the insurance companies can process them quickly and reimburse. So we're still learning. It's a learning curve, but
And this isn't just an us problem. At the state Mouth Forum the administrators forum had a conference in September. And as part of that, some of the breakouts was dealt with the billers, the medical billers that were billing these services, and they had a whole session on it. And a lot of health departments are struggling with this because the law wasn't written to reimburse public health. We're kind of an add-on. So it's been very nuanced, and everybody most places across the state that are new to it are having understanding it.
when it was originally designed and rolled out, it was really designed to address hospitals, provider offices, clinics, substance treatment centers. Public health really wasn't a consideration, so we're trying to educate each other, I guess would be the best term to use.
Well, when we figure it out, let's consult with these other guys and pay for that, right?
Mhm.
Chris has been doing a great job.
Good job, Chris.
Our car seat program, Mary assisted 18 families in the previous month and provided 27 car seats and did 4 additional checks for families. The last piece of news I have to share with you is actually not in the report, but we did receive this week notification from the Office of Highway Safety and Planning that our agency has been awarded a 1-year grant to address vulnerable population crash numbers that would involve horses and buggies across the jurisdiction. And so we are beginning the process of implementing our strategy. Josh Engelhardt will be taking the lead on this grant. We have our orientation meeting this morning with the Office of Highway Safety and Planning. And we are very excited to be developing our advisory committee across all 3 counties and to work on this project.
Is this in concert with the Amish population then? Or is it essentially,
Yes, so that's a portion of it. The grant will actually be working with road commissions. It will be working with law enforcement. It'll be working with driver's education programs, and then there will be a public education component within the grant. It actually, when we wrote the grant, we wrote it with a public relations campaign, and the Office of Highway Safety and Planning actually took our public relations piece and they tripled the budget and are doing that at a statewide level. But it will be targeted our 3 counties. So the grant project will be working as a component with the Amish community, but we're trying to ensure that we are addressing all the factors. So when we talk to the road commissions, it will be about, can we increase signage and awareness to where the Amish population may be traveling? And we look at taking off the tops of hills that may be blind in those areas. Creating wider berms to allow traffic to have more room. Working with the driver's education classes to talk to student drivers. It's where they may encounter populations or being aware of vulnerable populations. It's not just animal traffic and pedestrian traffic, but agricultural traffic. Just trying to raise that awareness of risks involved when you're traveling at 60 miles an hour and the vehicle in front of you is traveling at 10, which is the maximum or average horse miles per hour. 10 and 55, the physics were how so we're very excited about it. The state of Michigan Office of Highway Safety and Planning was very excited to see our proposal because they hadn't had anyone present this type of proposal previously. So we're kind of, what do I want to say, trailblazers. And if it goes well, hopefully some of the best practices that we can develop may be shared with other communities that may have similar issues.
Yeah.
With increased traffic crashes that a number of either life-taking or life-altering injuries. The sheriffs in all three counties were very supportive. Excited to work with the sheriff's department.
Is this stemming from all the accidents that are on Ottawa Road there and coming out of that?
Well, it's interesting that you say that. So part of what we've been working on getting prepared for this is we've developed some mapping that actually shows us where the concentration of population is. And we've also received crash reports from the previous year. And then we'll look at crash reports for this year, trying to identify locations of crashes and where we're seeing high density of crashes. We're going to look at times of day. So like in my perception, it was, well, it must be happening in the evenings or when it's getting dark and they're not well lit, that type of thing, or there's not great reflectives. But actually we're seeing more crashes during daylight hours. So my theory that was in my head when we went for the grant is just got blown out of the water. So we're ensuring that we're being data driven and that our efforts are going to hopefully have the best impact in the quickest amount of time. The plus side is that this grant is a renewable grant, so if we make progress but we don't complete our project, there is a potential for us to request funding again next year and to continue that funding process until we do see the goals that we hope to achieve. So very excited.
Yeah.
No more at 10:30.
Keep us posted.
So Rusty, those crashes, those recent crashes on Ottawa Road, this grant was already in progress before those happened.
Thank you for that report. Any questions? Any other questions? Keep us posted on that. That's very interesting. Thank you, Chris. We appreciate
If
that.
any of you have an interest in sitting on the advisory committee, please send me an email.
Sure it does. Nope. Gotcha.
Chris will be leaving, so that she can get to that training meeting today. So,
Yeah.
when she walks out, just wanted you to know why.
Won't be affected. But that's okay.
It's okay.
Very good. Environmental health. Joe, welcome.
Good morning.
Good
Thank
morning.
you. Kind of a brief update here, but my staff has been in the food section diligently working to get schools inspected. That's a big part of the early fall, is getting all the school lunch kitchens inspected. They're doing a good job getting that taken care of. We have posted the vacancy for my position. That is up, and we're hoping to get some candidates here in the near future so that we can start interviewing for that, so we can flesh out the staff here, which I'm really excited about. Some of the big things that are happening in the food anyways, over in Sturgis, Popeye's Chicken, I think, I want to speak for them, but possibly end of next week or the week after they might be opening if everything lines up for them. We're going to go out and do our job middle of the week. So, and we've been having quite a few plan reviews for a lot of hot dog carts still. They're very, very popular. People are doing those often. So we're getting those taken care of. Our last large festival was Apple Fest over here in Goldwater. That was taken care of, and staff did a nice job with that. On the well and septic side, I am pleased to announce that I did offer the position to Kyle Moore, who is our current Type 2 coordinator over in the St. Joe office, and he did accept. So he will officially take over his duties as the environmental health general supervisor starting on Monday. Kyle he's got a lot of skills. He's very talented, and I'm excited to have him part of our team and looking to the future, how he can help us grow. And that's super important for my vision of what we're trying to accomplish. The other neat thing that Kyle was a part of, and Emily Moats, we've developed a training opportunity with the state of Michigan to have state of Michigan Eagle staff come down and do a pool training, because we do conduct pool inspections throughout all three counties. And it's hard to get that type of training, and for them to be willing to come on down and utilize our space. And then we're gonna go to the Coldwater Aquatic Center to do a hands-on training and look at their equipment, how they do stuff. And that's a very large pool that does a couple different stuff that we don't end up see. That's great. So that went out to the Moeha listserv. There's a Tuesday. Within a day, we have filled one of our spots because we offered that training to other health departments in our jurisdiction or in our area. So we've invited people in, and it's already chock full. Like we don't have any space, at least for the field trip. The class portion, we're thinking we can open it back up and maybe hopefully get 40 people in here to do that. So it's a great opportunity not only to get to know our local health departments around us, but receive some great training. And on top of the training, Becky and I have been working closely with Eagle as well to get more on-site septic training for our staff, because there is a little bit of a vacuum training. We've got a lot of young staff, and so some knowledge has left the building. And how do you replace that training? And that's really going to help us better serve the community as well. So those are the things I've got going on in environmental health right now.
What's the pool? Is it like you come to my house?
No, the pools would be like hotels,
Okay.
some campgrounds have pools, and then of course schools have a pool. Or the hospital, Three Rivers has a rehab pool that they have, which is more. I'm sorry.
Well, pool.
There are.
Like walking around the backyard.
You haven't had your pool inspected?
Get on my list. I'm sure. Yeah, it sounds like hypothetically, if I had a friend who had a pool, I know it might have been inspected in a while. Sure, the penalties for that whole thing.
All right.
That's a good question. Thank you, Joe. We appreciate the report. Any other questions for Joe? So, well, congratulations, and yeah, we look forward to working with you.
Definitely.
Very good. Moving on, financial reports. Teresa.
Good morning.
Good morning.
Happy new fiscal year. It's in October, so yay! Lots going on as we work to close the old fiscal year. But before you have the bills for August, and I would be happy to answer any questions you have about those bills.
Any questions on the bill? Can I get a motion for approval of the payments?
Who's to pay?
Support them.
All right, we have a motion support. Further discussion?
We work together.
All in favor with an aye?
Aye.
All opposed the same? Bills are paid.
Moving along, you have the balance sheet. You will notice that the number that's due from state, the negative number there that we owe them back for overpayments is getting very high. Once we get into the new fiscal year, that will go back down because we'll send them back their money that they shouldn't send us in the first place. But in the meantime, we're collecting interest, so this is good. Then you have your scheduled cash receipts and disbursements that's been brought up to date. And then your grants by program. And you will see that the agency support RU10 continues to run over budget. And that is because there is more revenue in there than what we expected. So we've received more in interest than what we expected. And that interest revenue stays in 10 instead of getting dispersed out to programs, which is why you see that over budget, because we have to have enough expenses in there to cover that. So that will actually reduce the amount of indirect that's going out to programs because it's being covered in 10. So also, you'll see that the MERS pension underfunded liability is almost completely expended at 96%. That's because we made that final last big payment to them that we expected. And so that is probably going to come in line. But later in the agenda, we may be sending more money that was not originally budgeted there. So that might go over, but that's a good thing if it does. And then your PFAS for White Pigeon had a little bit of increased activity, so that's running high. Continue to monitor.
That's just White Pigeon?
That's the only one that's running home right this minute.
There's a separate budget for each PFAS site.
Really?
So you'll see White Pigeon,
Side landfill.
West Side.
How many PFAS sites do we have?
4 that we are used for?
We have 3 that we have
Three?
that are affecting the Lear Ziegler and Menden, and then the West Side landfill and the White Pit. 3 that we track on a budget.
That we have budgets for. There are other PFAS sites we track. We just only have budgets.
Yes.
Thank you, Teresa. We appreciate that. Any questions, Teresa? I'll entertain a motion for the financials.
I'll make a.
All right, we have a motion, support, further discussion. Seeing none, all in favor with an aye. Aye. Opposed, the same. Thank you for putting that together. Moving along to the agenda. 7, committee reports. Finance Committee. You have the minutes in your packet. We discussed quite a few of the new business items. That's about it. So I'll take a motion for approval of the minutes.
Approve the financial.
I'll support.
All in favor with an aye? Aye. Opposed, the same. Motion carries. Program Policy and Appeals did not meet. You guys are
I'll approve that.
you guys are good. Moving on. New business, MERS, underfunded pension payment and employee retention bonus. So we went over this in the finance committee. Becky, if you want to touch
Yeah.
on this, go ahead.
So, I was going it alone at the finance committee meeting, but Teresa's back from vacation and I actually would like to defer any additional comments to her.
Yeah, so as we've talked about many times in the past, the agency has a requirement to meet the maintenance of effort. So we have to spend a certain dollar amount, which is $664,000 something. So we're required to spend that much money to pull in all of our state grants. And at the end of the fiscal year, it's sometimes hard to determine if we're going to hit that because the financials lag so far behind the actual year. So this proposal would be to utilize the extra money that was not spent in the fiscal year because we are 10% under budget. So we do think that we are not going to spend as much as we need to spend. And so this proposal would be to utilize the funding and get it spent to meet our maintenance of effort and send up to $50,000 to the MERS underfunded pension plan, depending on where we come in when we get the financials, finalized for the year, and to pay a 3% retention bonus to the staff who received W-2s from the agency and that were still employed through the September 20th pay period. So the retention bonus would be calculated based on 3% earnings for the time that was worked during the pay periods ending January 12th through August the 9th. So it only would be hours, it would be 3% of the hours that they worked, not the hours that they were on vacation, not the hours that they were sick, not holiday hours, only the hours that they actually worked during that time period. And we brought this proposal forward. There was a suggestion last year when we were talking about sending additional money to MERS that perhaps we should do something for the employees instead of continuing to send it to MERS. So I brought this to you. We picked 3% specifically because we had to pick something, and 3% is what didn't get passed in the wage scale that we tried to pass last year. So we had budgeted for 10%. We only got 7%. So that is why we landed on 3. We had to pick a number that seemed like the appropriate number. But unlike a regular raise, this is not the gift that keeps on giving. It's a one-time bonus. And if you look at the pages following, it shows you exactly the dollar amount and who would receive what. I would be happy to answer.
So these yearly hours,
These are.
do we have any full-time employees?
That
Well-
vacation.
But it's only January 12th through August the 9th.
Okay,
And
that's what I meant. I'm like, that can't be a full year's hour.
It is only January, because I had to be able to calculate it, and so we picked that particular time frame, and then it also is not including vacation hours, sick hours, holiday hours. The only hours they actually
Full time is $19.50. just as, you know, for an entire year,
Okay,
19.
but the most I seen on here was like
Yeah.
1,100 hours. I'm like,
Yeah.
what is going on?
Yeah, because it's a partial year and doesn't count vacations there.
Any questions?
Thank you. I think it's a good idea, 50,000 go to the mayors and 50,000 to the employees. However, my question is, any employees who left just say last day of August and they left the next day? I mean, I'm just thinking about those kind of questions.
They left.
When you see these issues there, you may want to check that.
Yeah, so the proposal was, I tried to cover that in the proposal. So it would only apply to employees who were still employed and worked through September 2024 pay period. So if they left before the end of the September 20th, 2024 pay period, then they would not be eligible. If they worked through that pay period, then they would be eligible.
You know, former employees deserve it. The bread 3 years ago, they used to get the whole loaf for whatever price it was. Now the same amount I get a loaf about this.
It's better than they eat less carbs.
Thank you, thank you. Employees deserve it. I have no problem, Mr. Chairman.
Any other questions? I guess a question that I have, and we talked about this. So Teresa, are you saying that if roughly our maintenance of effort is around 660,000?
664,000.
664. So are we saying that we're projected to be about 100,000 under that?
I really don't know exactly where we're gonna be right now. The finances, because I was on that 2-week vacation and all of the year-end things that have to happen. I'm not as far along as I would like to be at this point. At the present time, I do think we're gonna be below the 664,000. And our local appropriations, we have over 700,000. So we have that wiggle room there. So we can do this even if we're not quite all the way, if we're not $100,000 below the 664, we still will have enough local funds to cover it in appropriations that limits.
Okay. And we've talked about it before too. I am all about paying down our liability on the MERS, which I'm okay with. I know Commissioner Leininger has brought up the fact, I don't know if he's talked to you about it or not, about the constitutionality of paying retention bonuses to employees. Okay.
Yeah,
He lost me like he usually does. Pretty sharp guy. But that's something that he's talked about. I know we as a board approved the 7%. I do feel it's a little bit of an end around to say, and I know this was brought up last year to Teresa's point, as a board, we discussed this, so it's not on staff obviously, but about retention bonus. I would be more, I guess I'd be more willing to do it towards the MERS, like the full 100,000 or just the 50,000, that type of thing. The retention bonus is just a little bit, I just feel like, as a board we came together and said 7% at the beginning, now we're going to change that. I don't know if I'm too willing for that.
Well, it kind of feels like, they budgeted 10%, or 10%, and then they didn't get it. So we gave you 7, and here's what luck we want to get that back here.
Yeah, I don't know.
That's just the feel in the optics that it has.
Sure, and I can understand why I would feel that way. And we did make a budget amendment to try to address this, but we have positions that have just gone really long times without being filled. And so the staff, and we haven't been able to spend the money where we expected to spend it on salaries.
Yeah.
And the staff have had to work harder to cover because they have positions that are unfilled.
Yeah.
And part of the reason it's difficult to fill is where we sit with pay. So, I'll just use, Joe just recently hired Kyle, but there was another individual that we reached out to who turned us down because of where we sit with salary. And You know, we still got a great candidate, no doubt about it. But we struggle to compete with salary for the best team.
Well, some are down here talking about local money that we get sold in the bank. That's overages of what we don't use from the local appropriations,
It's total, isn't it?
or is that just yearly, every year?
So every year we get local appropriations for
Right.
committees, and I did not look up the exact number. It's over $700,000. I can't remember the exact.
So it's spent throughout the year.
And we budget to spend that entire amount, but we haven't spent it this
How
year.
much is there?
I don't know the answer to that right this minute because the financials lag behind. And a lot of the grants, when we get this late in the year, we may not have had to apply much to a program of local dollar because the grant will pay for it.
Okay.
But when the grant runs out, then you're putting 100% of the
Right.
expenses to the local dollar. So it's kind of hard to project at this point without taking a lot of time, which I apologize, I did intend to do, just ran out of time.
You're
How
good.
dare you go on vacation?
I know, right?
I know.
John, any questions, any comments, concerns?
Listen to you guys, trying to get the temperature of the water.
It's warm at 10.
It is.
Yeah, go get away on the whole thing.
I am too. Honestly, I don't see, I agree with Tracy. Here's the thing. I mean, we have an awesome staff and they work their butts off. So I am not opposed to doing a retention bonus. I like the MERS because I'm just, kind of fiscally conservative. I want to pay off pensions. I want to pay off our debts. If we can do both, I'm okay with that too.
Thomas.
Tell me where the finance committee sat, because
Hey, the finance, we punted. We punted it up to the
course you
board.
did.
Now we were hoping that
Of
we'd
course you
have
did.
6, Now we got
Yeah, and we did. We did, was,
I'm not gonna be the bad guy. I make them do it.
Yeah, and it's not really being a bad guy.
No.
We just want,
Everybody's
everybody's opinion. Yeah.
do Hillsville and Pitt.
Yeah.
Well, they got rabies, so they're not.
Yeah.
Mr. Chairman,
Yes, sir.
thank you. The finance committee or personnel committee, they are just tools to boil things up, come to a conclusion and recommending to them. So we who are here right now, we make a call, whether $50,000 each or not at all. That's all. So I again say if it is legal, give it to the employees and let them go to Ireland or wherever they want.
So random.
Ireland.
Very
Oh,
random.
I didn't know.
We appreciate that. Though.
You want
Make
me
a
to
motion,
make a motion?
Yeah. Go ahead.
Yeah, go ahead. Please, I second.
Just a second.
You can't second the one first.
We'll entertain a motion.
I support.
You can't.
He did.
I moved that we accept the retention.
Commissioner Matthews, second that.
I support
Okay.
the 3%.
Okay. Further discussion. Anybody else? Okay. Do we have to do a roll call?
Get that idea.
Okay. Let's do a roll call.
Commissioner Matthew,
Absolutely, yes.
Commissioner Houts.
Yes.
Commissioner Hoffmaster,
Yes.
Commissioner Baker.
I don't matter.
Yes.
Thank you.
Too bad.
You have value. Okay, very good. Motion passes. Good luck. And we do appreciate, that does not go unseen. You look at the hours and guys, we appreciate everything that you do. So hopefully that comes across. Very good. Good. Medical director's contract. Ms. Teresa did pass out the contracts. So
So you have
Reviewed it
two
and I liked it.
there you go.
I was gonna say, you had 2 different sections. One was actually signed and the document that has that's the smaller font is what the board reviewed. The rest.
I make a motion to approve the medical director's contract.
We have motion. Do we have support? We have a motion support. Further discussion?
Yes, Mr. Chairman. It was appropriate. God willing, I will not be here next year. I would like to know, we intended to give 3 years to our Dr. Luperillo, if it is appropriate, I would like to know why you are only requesting 1 year. You don't have it on file. Will you?
No, I'm fine if that's okay. with you. So the board should find
Came to our finance committee
I
also.
did go to the finance committee. So first, I guess I'd like to say that, you know, I've always talked to my children about choosing a job and a career. And this, I want to go on record, fills all of those criteria, right? I've always told them that they need to enjoy what they do. They need to be challenged by what they do. It shouldn't be routine. It shouldn't be the same every day. They should learn. They should want to go home and read about something that they heard about that day. And it should help someone, right? The community that you live in, or a greater group of people, or it should help someone. So I want to go on record saying that this definitely does that for me. And I had all intentions of signing the 3-year contract. And it came up at the last board meeting. Not very easy for me to talk about finances, right? Because I'm not starving, but the loaf of bread has certainly gotten smaller at my house as well. So my contract for the last 3 years had nothing in there for any adjustment to finances, right? It was just a set salary. So we talked about that at the last board meeting, and it got decided that I would get the raise that the rest of the health department got. And then I went home and I thought, well, what if the rest of the health department doesn't get anything for the next 3 years? Then I would stay the same for 6 years. And that just kind of didn't sit well with me. So I just asked for the 1 year just to be sure that there was some thought process to some sort of financial improvement, be it 2% if that's what the staff got, be it no percent if that's what the staff got, be it 10% if that's what the staff got. So I just thought I'd go with 1 year, see what happens, and then hopefully be able to kind of know what the staff gets every year and go with that.
Mr. Chairman, thank you, Dr. Luperillo. Your point, has any business person or business companies and our health department, in my view, I'm sure many of you perhaps agree with me, we need is a long-term plan. So we have a lot of resources, Mr. Chairman, in our health agency. I serve on the state level. I know there are plenty of money. So I wonder, the finance committee and the health officer and the finance director to sit down, Dr. Luperillo, to see her background, education, plus she just got an MBA, MBH. So perhaps, Mr. Chairman, we as a board to think whether she can stay 3 years rather than 1. I mean, every year. Commissioners now 4-year programs, there's 4-year programs, and we have a long-term strategy we have. So just my suggestion, that's all. If she's willing to sit down with the finance committee and previously indicated, both of them, that gives us a program takeoff, and many changes may come next few years in the healthcare already we discussed here. So I just my suggestion that.
Well, my thing on that, we have a new board, start first year with new commissioner. This 1 year is what the doctors requested, and I fully plan to accept that 1 year and then a new board address it.
We have a new board, only 1 person or 2 persons
It could be a change.
not be
It could be a change, at first.
We could all voice for more, I mean, really.
Let's not get out of control here, guys. Well, we appreciate that. Commissioner Matthews, I appreciate that. We'll definitely take that into consideration. We appreciate what Dr. Luperillo is doing for the agency and her value add. So that's very good. Very good suggestion.
I moved to accept the 1 year.
We got it. We got a motion and support. Now we just need to
Vote.
call the question. All in favor with an aye? All opposed the same?
Do we have to take it, Mr. Chair? Point of,
Yes, sir.
to. I lost my thought.
Roll call?
Oh, thank you.
Do we need a roll call?
There's no money, I should.
For closed session, we do.
No, for the contract.
Okay.
For the contract?
I don't think we need one, but if you would like to have one, go ahead.
Accept it.
Yeah, we're good. We accepted it. Moving on to closed session.
To make a motion to consider a periodic personal evaluation or go in closed section for a periodic personal evaluation of health officer per section 8A of the OMA.
That's good.
I'm gonna do a breast figure.
Support that. All right, we have a motion and support. Roll call.
Commissioner Matthews. Commissioner Houts.
Yes.
Commissioner Hoffmaster. Commissioner Baker.
No.
It doesn't matter.
Matter.
It does matter. Or to close session stuff.
Unanimous? Is it
Is that unanimous?
unanimous?
Yes.
Does it really? All right, we're unanimous.
Oh, my.
Jeez, oh, Pete.
We'll see you all.
question? Thank you. Do we have to read back the minutes or no?
We can't read it back.
Yes.
Okay, can't read them back.
Except
Okay. I'll make a motion, or I'll take a motion for the closed minutes, accepting the closed session minutes.
okay.
John or Rusty? All in favor with an eye? Aye. Opposed the same? Okay. All right, very good. We are on to merit pay for the health officer, Miss Rebecca Burns.
I move that we, fill it with the health director received a, satisfactory work evaluation for fiscal year. Right.
Mhm.
And that we approve a $5,000 bonus.
Merit
say
pay
about
for.
I saw.
We have a motion and support. Any further discussion? I think Rebecca's doing a great job. We appreciate what she does for the health agency. We appreciate the leadership that is built around her. Rebecca definitely gave kudos to all of those people. I think the staff is doing a great job. We appreciate what Teresa's doing as her right-hand woman. We look forward to the future with Rebecca leading the steering the ship.
I agree with you, Mr. Chairman.
All right. All in favor with an eye? Aye. Opposed the same? All right. Motion carries. Very good. Thank you for everything you're doing. Moving on, public comment. Do we have any public comment? No public comment.
I'd like to do this.
Thank you, Mr. Chairman. It is my honor to make a motion to adjourn our October 3, 2024 meeting of the Board of Health.
We have a motion.
Yeah, I'll support that.
We have support. All in favor with an eye? Aye. Opposed the same. All right. Motion carries. We are adjourned.